Nursing care plan for diarrhea. Nursing assessment. Assess the history of possible exposure to infection, causative agents, contaminated foods. Assess the history of allergies. Assess physical examination. General condition. Subjective data. Abdominal pain, nausea and vomiting, abdominal cramps. How many times passed watery stools per day? Objective data. Cyanosis, pale, cold extremities, moisture. Assess the neurological status. Conscious level, switches. Nursing diagnosis. Deficit fluid volume related to vomiting, diarrhea, lack of oral intake as evidenced by dry mucous membrane and decreased skin turgor. 2. Altered nutrition level less than body requirements related to loss of appetite and altered bowel habits. 3. Acute pain related to abdominal cramping and diarrhea. 4. Risk for electrolyte imbalance related to diarrhea. 5. Risk for dehydration related to diarrhea and lack of oral intake. 6. Risk for impaired skin integrity related to altered bowel habit and increased frequency of diarrhea. Nurse's diagnosis number 1. Deficit fluid volume related to vomiting, diarrhea, lack of oral intake as evidenced by dry mucous membrane and decreased skin turgor. Goal: to restore adequate hydration status. Planning. Monitor vital signs. Administer oral rehydration solution as prescribed. Administer IV fluid as prescribed. Monitor input and output. Monitor weight daily. Assess skin condition. Administer antidiarrheal medication as prescribed. Implementation. Monitored vital signs. Administered oral rehydration solution as prescribed. Administered IV fluid as prescribed. Monitored input and output. Monitored weight daily. Assessed skin condition. Administered antidiarrheal medication as prescribed. Evaluation. Blood pressure, temperature, heart rate, respiratory rate, input and output with time duration. Nursing diagnosis number 2. Altered nutrition level less than body requirements related to loss of appetite and altered bowel habits. Goal: to ensure adequate nutrition level. Planning. Give oral care before eating. Monitor dietary intake. Monitor bowel habits. Give health education about push to avoid, or help to control diarrhea. Give warm meals. Implementation. Give oral care before eating. Monitored dietary intake. Monitored bowel sound. Gave health education about food to avoid and help to control diarrhea. Gave warm meals. Evaluation. To be evaluated later. Nursing diagnosis number 3. Acute pain related to abdominal cramping and diarrhea. Goal to relieve pain. Planning. Assess pain level. Administer analgesis as ordered. Keep warm heating pads on abdomen. Teach patient to avoid very hot and cold food or liquids. Implementation. Assessed pain level. Administered analgesis as ordered. Kept warm heating pads on abdomen. Taught patient to avoid very hot or cold foods or liquid. Evaluation. Pain level. Pain is reduced more than earlier. Nursing diagnosis number 4. Risk for dehydration related to diarrhea and lack of oral intake. Goal to prevent dehydration. Planning. Quantum vital signs. Assess the skin turgor and oral mucous membrane. Assess capillary refill time. Assess the color of urine and amount. Administer ORS as prescribed. Administer IV fluid as prescribed. Implementation. Monitored vital signs. Assessed skin turgor and oral mucous membrane. Assessed capillary refill time. Assessed color of urine and amount. Administered ORS as prescribed. Administered IV fluid as prescribed. Evaluation. Body temperature, respiratory rate, pulse rate, blood pressure, capillary refill time, urine color. Today's our sample care plan discussion is over. Like, comment and